Video. So this meeting is now being recorded. Thank you all so much for coming today. Like it was posted on the screen earlier, if you haven't already, please drop your name, your pronouns, where you're coming from, and what year you are in school. We want to know a little bit about you, and we'll go ahead and get started with the presentation. Ashley, I'm gonna make sure that screen sharing is available for you, and we'll go ahead and get started.
Great, thank you.
Okay, here we go. 1 second. Okay, that's not what I wanted to show you all. Here we go. Can anyone confirm that you can see my slideshow? Thumbs up? Yes. Okay. So hello, everybody. Welcome to the White Coats for Black Lives Spring Seminar Series UHS Volunteer Orientation. My name is Aminta Kuyate. I am one of the founding members of the White Coats for Black Lives chapter at UC Berkeley. Like I said already, put your name, pronouns, locations, and year in the chat. This is our team. We have Camila Hurtado, Mary Conjiro, myself, Fatima Rinderconnect, and Haruna Aridomi. We're all second years in the UCSF-UC Berkeley joint medical pronoun. We all use the she series of pronouns. This is our second round, so we now have MS1s who have come up behind us who are going to be taking over kind of when we transition over to UCSF. We have Ria, Justin, Jessica, Kate, and Jessa, and they're a wonderful group, and I hope we'll get to meet them. Our first seminar actually kicks off on Friday, which is tomorrow, so I'll have a little bit of information about that, and I'm going to give just a little bit of information about myself, kind of what White Coats is, we do on campus, and then we'll talk about Ashley will give us an overview of the UHS volunteer opportunity. I also really have to shout out Semhar Teklu. Some of you may know her. She's our public relations fellow extraordinaire. If you follow us on Instagram, if you see anything that we've done, it's honestly because Semhar got it together for us. So shout out to her. This is me. I am originally from Oakland, California. I'm a former community college student. I transferred to Berkeley for undergrad. In undergrad, I did extracurriculars and research, volunteering, a lot like what I'm sure many of you are doing. And I recognize the unique challenges right now with COVID. So we really wanted to partner with UHS to give you an opportunity, especially for underrepresented minority students, to be able to get access to some of these things that we were able to do when we were pre-meds. I'm considered a non-traditional medical student because I took around 5 years off between undergrad and grad school, and I worked all through undergrad. So I was always working up to full-time while taking classes, and it was really challenging. So actually on March 18th, we'll have a seminar about navigating paths to medical school for non-traditional students. So stay tuned for that. This is a picture of the day that I got my second vaccination at UHS with the physician who was training me on actually how to vaccinate. So that was great. I got to shadow my own vaccination. And this picture was the required vaccination picture taken in the bathroom at Poly Ballroom, which many of you will be volunteering at. So yeah, I'm currently a volunteer vaccinator. I'm the pathway development director because I think programs like this are so important to make sure that everyone is getting access to the same information about applying to medical school and to really make sure that equity is part of the pathway from the beginning. Like I said, I'm an MDMS student, and my thesis is actually on anti-racism in medical education. So if anyone is interested in talking more about what it means to get a dual degree, or if they're interested in doing a master's thesis someday, please reach out. I'd love to talk to you about that. So White Coats for Black Lives, we founded our chapter because we hope to strengthen the pathway connections across the lengthy pre-medical preparation and medical school application timeline for students who are underrepresented in science and medicine. And so, but to do this, we host a series of events, provide research and professional development opportunities, and direct mentoring. If anyone is here who's actually a participant in our mentorship program, can you raise your hand or drop it in the chat? I know that. Oh, nice. Odochi, hi. Okay, I see a bunch of y'all. Okay, cool. Just checking. You can go ahead and put that down. But I just wanted to see kind of who is here today because it's really great. And for those of you who aren't involved in our mentorship program, we definitely hope that you get connected. Okay. So before we go forward, we're going to do an anonymous demographic poll. This is really just so we are funded by the Big C, which if you are a student group and are looking for funding, it's a great place to get funding. But we have to do these polls every time. So I'm going to go ahead and launch this poll. So if you wouldn't mind taking 1 second to do that. All right, we're at 74%. We only need a couple more people. All right. I'm gonna actually just show you all. So we have got a diverse group of people today. I think there's no requirements to participate in our program. I'm just gonna show you all this poll and take a screenshot because I'm required to for our funding. But thank you for doing that, and make sure that you did both questions perfect. Screenshot again for I think because I am too much of a dork to figure out how to save the poll otherwise. So thank you for bearing with me. So now I'm going to go into very briefly about our seminar series. So this is a super great thing that we're offering for free. A lot of these kind of seminars and the information that you're going to get in these seminar series, people pay like thousands of dollars. We paid thousands of dollars, and I had to work super hard to be able to get access to this information. So we're trying to make sure that y'all can get it for free. So March 5th, like I said, tomorrow, we're going to talk about AMCAS. Fatuma and Ria are going to do an overview of what the actual application on AMCAS looks like. On the 18th, I'm going to talk about non-traditional pathways and how each of you belongs here, and that we are going to do everything that we can to make sure that you feel that way and are supported in the pathway. Then more about the AMCAS application process. There's going to be a seminar from the Berkeley Public Health librarian on how to write a scientific paper, which is something that I did not figure out until I fell flat on my face the first time that I tried to do it, and then had many panic attacks about it and figured it out. So we're hoping to give you some of that information straight up. And then a personal statement workshop. Like I said, there's so many different things that people can do on the pre-med pathway. The partnering with UHS is a really wonderful opportunity, and I'm so glad that there are 103 of you here today to be able to participate, because this is a way to not only give back to our larger community, especially in the vaccination process with COVID, but also for you to build your pre-med resume and pre-med CV so that you can be competitive in medical school. I understand there's a lot of ethical considerations, especially around asking people to volunteer, especially now. So we're going to try to work with our funder, with the Big C, to do everything that we can to provide some scholarships and opportunities for you while you're doing this, to make sure that you also get the most out of your volunteering experience. One of those things is that we're actually going to, Ashley amazingly coordinated this. There's going to be a basic life saving skills. I never remember what BLS stands for, but I think that's it, right? BLS? Yeah, okay, Ashley's nodding. I do this every time. But it's going to be $68 per person, and you get certified as a CPR or BLS provider. If you are a member in our mentorship program, we're possibly going to be able to fund you to do this. If you're not a member, it's going to be $68. We're trying to figure out the logistics of that, but we're going to try to do this. The great thing about this is that if you're BLS certified, you can then volunteer as post vaccination observers, which is really important. I'm someone who has, a history of anaphylaxis, so I'd love to see some students like you, like monitoring me to make sure that I'm okay after I get my vaccine, and I know other people would feel great with that too. Only a few more slides, and then I'm going to pass it over to Ashley. We recently opened our intern application, and our fellowship decisions are coming soon. If you have applied, just letting you know, that's going to come up. We also have some scholarships that are coming soon. So we're working on giving $500 scholarships to students, especially for people who volunteer long term and who it's a financial barrier to be able to volunteer. We're going to really work to make sure that we can use some of the funding from Berkeley to provide that for you. So that's where this is all what White Coats is contributing to this. And then now I'm going to pass it over to Ashley. I can stop my screen share. And then I'm going to pass it over to Ashley, and I'm going to admit everyone who's been in the waiting room all along. And then she's going to go over what UHS is going to provide. Thanks, Ashley.
Thanks so much, Aminta, and thank you everyone for being here. It's been such a pleasure to meet Aminta and learn all about the leadership roles she carries and the influence that she has and how we could partner. I can give you a real brief background. We here at UHS, at University Health Services, found out really fast one day that we were going to be able to vaccinate 700 people in a coming week. And so it was a real scramble to get people trained and get people on board. And before we knew it, we were getting 2,000 doses a week. And so people like Aminta and the JMP program, student volunteers and health workers, we couldn't have vaccinated people without them. So this partnership has been incredible, and we're really thankful. It's really been a blessing too. So we want to keep it going and find ways to operationalize it. So even post-COVID, we can keep this relationship. Feel free at any time to turn off your video. I'll not be offended. You're in your personal space, and I'm fine if you're not on video. I will also say I am a bit hard of hearing, so at any time, if you want to shout out a question or flag me down, interrupt me. But if you ask a question, if you put it somewhere I can read it, and thank you, Aminta, for sharing that doc, it will help me a lot to really hear what you're saying. All right, I'm going to go ahead and share my screen with just a short document that I've prepared. I can't see all of you while I'm looking at this, but again, feel free to talk out and I'll navigate back to chat too. So thumbs up if you can see my screen. Cool, thank you. So really brief history of University Health Services. We serve both students who have student health insurance through our program, as well as students who have an outside insurance. So typically we're managed care, which is like an HMO. We give referrals to anyone that we don't have here, but we try to be the provider for all of care here. So we have an urgent care, we have a primary care clinic, we have a specialty, we have a really cool allergy travel clinic for students who do research abroad. We also have faculty and staff programs. We have occupational health, so we see a lot of faculty. We consider your mental health part of your whole health. So even though we have counseling and psychological services as an additional wing in the building, we also have embedded behavioral health therapists in our primary care program. So we're a whole big mix and blend.
Ashley, I'm going to interrupt really quickly. Would you mind zooming in so students can read the doc?
Oh yeah. Let me go over here. How do I actually zoom in?
Over on the left, on the toolbar, there's like 100%.
Oh, cool. Yeah, I could totally do that. So sorry. And I can share this to you guys too.
Yeah, we can also put it in the chat. That would be great.
I will do this and get out of here so I can drop in the chat. Thank you guys. I forget how tiny it can be for everyone. All right, so you've got that there, and I'll go back and screen share and zoom in. All right, so tools.
I think it's actually over on the left. Do you see that 100% sign down one row?
Oh, thank you.
Yeah.
Oh, I have our faces in the way. How's 150? Is that better?
Better. Yeah, thank you.
Cool. Okay. Yeah, so I mentioned some of our clinical departments, and we also have some non-clinical areas like health promotion, faculty staff, some wellness programs. A lot of these were really active pre-COVID, but nothing stopped while COVID happened. We just had to morph. So it's been a really exciting time. In addition to those, we have some ancillary areas like pharmacy, lab, the physical therapy clinic. And so I mention all of those so you can really get the broad view of where these opportunities can live at the Ting Center. University Health Services encompasses some satellite offices. We're in a few other locations. There's a Path to Care location. But when I talk about the Tang Center, that's physically where I am in the building here on campus. So a short overview of the history of our volunteers. And many of you may be familiar with our health promotion department here. They do pretty incredible education and partnerships with lots of communities, the Greek community. I think we're coming up on sexual health, sort of a celebration education period for them. So they're really the forward-facing health promotion, very fun department. And they typically house our volunteer program. So there's a volunteer coordinator there who in the past would sort of take applications and place students within departments. When everyone went shelter in place and went remote, that program paused. And then with the COVID response, we've really started opening it up and realizing that it can be a lot bigger. So that was the history of sort of the health promotion volunteer portion. Health Promotion also hosts UHS Health Workers. This is a fabulous opportunity, and I encourage all of you to apply. Application period started March 1st, and it ends on the 31st. So our health workers are in dorms, or they'll visit events. They'll go to University Village and visit the families there. Um, they they really are great liaisons to the community, and they are considered part of the UHS family officially. In some cases, they get scholarships or stipends for their work. It is sort of a class run and credit system. So they do meet on Tuesday nights. I believe it's a 2 credit class. But if you have goals for medical school or public health, or even just are looking for a way to be an active collaborator in health here, this is a fabulous program. So I encourage you to look at that. And of course, I'm available if you need more information or help with your application. So here's the meat of all this, and the most exciting part, right, is COVID response. So in the past, when we had our admin volunteers or our pharmacy volunteers, it was just very standard. And the COVID response changes by the minute. So we have suddenly surveillance test sites, and we have swab coaches there, so we can take volunteers in that role. The vaccine clinic literally changes by the day. Some day we see thousands of people, some weeks we see thousands, some weeks we're really not sure. At this moment in time, we're not sure beyond March 23rd what's to come, and we've really made ourselves okay with that. We're here in service by the day. We stay at the ready. We stay trained. We call ourselves sort of a surge reserve. So we've got our pool of volunteers that we can pull if we need unique tasks. And if we don't, we're okay sort of hanging back and waiting to be available. The vaccine clinic has some non-clinical roles that would be excellent for you. They are sort of an information desk area, line control areas where you're helping people navigate through the poly ballroom. There are some roles for registration, but we also have a unique relationship with the unions. And so at the same time we offer volunteer opportunities, we want to make sure we take care of underemployed staff. So the registration roles might be more for those underemployed staff that we're supporting with income. And thank you for filling out Amita's volunteer response form. I think many of you would be interested in the vaccine clinic, and we'd love to have you. So I'll also do sort of my own reach out a little bit later, and we can do a more targeted vaccine clinic orientation and get you into some of those roles. Meal delivery is more of a new opportunity. I don't know if any of you are in campus contracted housing, but in the past surge, there was not a lockdown. That sounds like an awful thing, but there was sort of a mini shelter in place for our students who were in certain dorms. And in order to support that infection control initiative, for them to stay in and stay safe, we suddenly needed to organize volunteers to bring them food. So something as simple as doing a contactless hot meal delivery to someone, or a quarantine kit. And again, this is all infection controlled. You're not at risk while you're doing this because it's contactless, but to be able to support students in that way could be a need that, again, we would sort of hold you in a surge reserve and then reach out for who's available to help with this. Surge reserve also helps with contact tracing, and I can talk a little bit more about that. But they would also do things like, we've had anything you can imagine come up, like, hey, we're switching labs and we need to suddenly build 500 lab tests like tonight. So it could be anything on-site or remote. I try to send out a volunteer email to non-clinical volunteers each week with opportunities. And most of the time people will self-schedule into roles. It's a pretty autonomous program, and we like that. We're here to support you, but also empower you. Contact tracing. This is an interesting one because contact tracing is going to require a bit more training than the other things. Some of it's online, some of it's here at Tang, and a lot of it is in a protected medical record of your own peers. So we're really mindful of the training that you get so you can feel comfortable and be responsible with that accountability that comes with that. Contact tracing, ebb and flows. So we're coming up on spring break. We do anticipate a small surge after spring break, just because of the natural tendencies of travel and activities around that. And so we've put out education, hoping people will make good choices around infection control, but we are preparing for a surge. So in that way, we would need more contact tracers, while right now, pre-spring break, when not really too many people are traveling, our contact tracers have pretty low activity right now, which is a good thing. So again, I think a good thing to do for that was I could sort of poll you separately. I've got a list of interests from Aminta's form, and we could do another targeted orientation around contact tracing, and then sort of have you guys ready for if we needed to pull any that way. And I think those targeted orientations would be good times for really specific questions too. But I'm moving quickly only because I don't have time for questions today. Before I move on to possibilities of future, does anyone want to take a moment to make comments or ask questions right now? Okay. Let me get out of here so I can see you and I can see your chat. Hi, applied to be a health worker, great experience, super. I'm gonna go to Amita's question stock. If you've got questions there, I can read them.
Apparently, we're covering everything, so people
Okay.
don't have many questions yet. One just came in from Natasha. It's in the chat. Do these services also help UC workers?
Do these services also help UC workers? Do you mean like UHS staff? Could you define UC workers? Let me go back down here. Sorry, I'm scrolling through.
Yes.
UC workers for staff. Okay, yes. So we do have, that's a good question. We do have a faculty staff program. Faculty staff programs involve everything from occupational health to, if you're traveling, what vaccines do you need, to mental health counseling and behavioral health counseling, family counseling. So there could be opportunities there. If we talked about the research side of it, faculty staff research could involve some data entry or literature reviews or de-identified surveys and polling, things like that. But if there's a department in the building, I'm confident we can find a role, even if it's in an admin role, that someone could assist in. For vaccine clinics, do you anticipate volunteers being on reserve? That's a good question. So we have about a third more volunteers than we have slots, and we like it that way because we want, if our volunteers need breaks or if they need to travel, I'm looking ahead to next week, about half of my volunteer force is not available. So we fully staff it, no matter what's ahead or what's looming or what we're not sure of. We do each week, 1 week ahead, fully staff it. Volunteers could go on reserve. Like I said, after 323, we're not sure what we'll get. We could get vaccine from the county. We could get it from the state. We could get it not at all. So they could go on reserve, or they could be offered other opportunities as well. Things like contact tracing in the vaccine clinic will get targeted training, but we also recognize that, it's a big, generous donation of your time to step up and respond to the University Health Services call for volunteering. And so if you're willing to join that and join the family and, you're here and you're dedicated and you want to find something to do, I'm pretty confident we can organize things. It's good for our soul too. It's not just sort of showing up and doing line control, right? It's community, and that's important. Will we choose COVID response? That's a good question. Yes, you will choose your own program. We want you to feel confident in what you're doing and to like it, and ultimately to serve your goals. So we'll send out those targeted polls and targeted orientation offerings, and you're not obligated to do anything. You can try it once and say, this isn't for me. You can try it and love it and stay on, and you can try other things too. I had 2 volunteers start with line control and they really liked it, but then they tried swab coaching at the test site and they fell in love, and no hard feelings. They're test site swab coaches now. So I'm happy for you to choose your own and move as you like. Do we need to be vaccinated? So you do not need to be vaccinated. We encourage you to be vaccinated. We are pro-vaccine, 100%, but it is optional and it's your choice. You don't have to disclose if you've been vaccinated. You are eligible to be vaccinated. I would encourage you to go to myturn.ca.gov rather than UHS, because your chances of getting that guaranteed second dose are a lot better with MyTurn right now. We're seeing our patients being able to get MyTurn appointments within 4 days or so. Sometimes it takes a lot of screen refreshing, but that's the best way to get a vaccine right now. So contact tracing is kind of remote, but kind of not. And I wouldn't say it's the only remote opportunity. We can get pretty creative. So if one of you is interested in transgender patient care or mental health services for the Latinx population, if you've got a topic that you're interested in, we should work with you to partner on that interest and see if we can connect you with someone and get you into doing some research or presenting to a group here and getting some feedback. Maybe we could do some leadership interviews. We're not so hard put on having this is a volunteer role and you have to fit in this puzzle piece. We really like this program. Working with the GMPs has taught us that it's an important partnership, and like I said, it's good for our soul. Walgreens has vaccines too. That's great to know. I'm glad that's coming through. Thank you for mentioning that. When exactly does volunteering start? Volunteering start is at will. It's ongoing. We do not close here. So we close for a curtailment period in December, but we'll be here through the summer with anticipated surges as travel comes and goes. So we do ask for a 2-month commitment, even not just to a particular role, but just to say if you're going to sign up and join us here, that we can count on a relationship for about 2 months. So that can start whenever you're ready. If you're not back until fall, this is not a one-off opportunity. We'll still be here, happy to talk about this as much as you need. So unlimited, is it limited from Monday through Friday? That's a good question. Thanks, Esperanza. We are considering opening a surveillance test site on Saturdays. So right now that's the only weekend opportunity I know of. We do have limited urgent care hours on the weekends too. And I'd be happy to ask a nurse manager in urgent care if someone's only available on a Saturday morning. We'll ask if she has a role or some tasks that a volunteer could help out with. Would love to do that for you. Flexible, so the flexibility of volunteer shift scheduling depends on the role. For the vaccine site, it was a pretty solid 4-hour shift once a week, morning or afternoon, and the hours were pretty set because it impacted patients if we didn't have everyone on board. But things like volunteering in admin or doing research, being a research assistant, there's a lot more flexibility. So I hope you take confidence and good feelings in that a lot of this can be catered for you. And if you're the type of person who really likes structure, then that once a week vaccine clinic or once a week swab coach role would be good for you because you can count on it consistently. How to get involved in research? Isn't that a fun question? I'm going to say that back to you, that you can get involved in research at any time because you are you. And I think Aminta and I both have experiences where we've sort of stumbled into research projects and just really run with it. The formal answer is we have a few research projects going on here. So, and a few people managing it. The leadership team has sort of asked and put out feelers for everyone to say, we'd like you really to consider if you're doing a research project to take on a student. So even myself, I'm presenting a poster on some policy review, and so I would love to take on some students to do lit reviews if they're interested in my topic. And that way we can help each other. Um, I had on my doc, I'm not going to share it again just because I like seeing your faces, but one of the upcoming opportunities that's on that document is something called a research colloquium. So the assistant vice chancellor and I were both really interested in research, and we saw a real need for something non-COVID. So when we went shelter in place, we started this colloquium, which is a place for UHS staff to present research that they're doing. It's a good foundation for us to bounce ideas off each other before we apply to a conference. Sometimes we rant about IRB approval that we can't get, but it's a really great community. And so what the Research Colloquium is hearing today is that I've talked to you. I'm going to ping them for projects that they have going on, pin down some roles so that I can offer to you, hey, does anyone want to do data entry for this or lit review for this? So that's probably going to be your most immediate way to get involved in research with us. I am aware of other research projects that are outside of the colloquium. There's a nutritional science one going on. I know there's a quality improvement one going on in CAPS. So my work also involves reaching out to those people and saying, hey, let's put this in a central place and then really take on the goal of how do we involve a student? How do we get some research assistants on board so we can build this community? Process for signing up as a volunteer. Aminta shared the vaccine rollout volunteer form, but in addition to vaccines, it had some other opportunities on there. I'm working off that form, and that's probably the best place, but I'm happy to give my email address too, and you can reach out to me. I've got my own volunteer interest form. It's just much easier to contact you and organize you based off a form. Sorry, I'm reading direct messages. Would helping in urgent care with patients be a possibility during the week? I can ask. I'm happy to ask for anything. So I did go through your form and got some good topics from there. And then I'll be pinging the leadership team here and, like I said, the research colloquium and really pinning down some roles for you. But in the past, we pulled for volunteers and then we plugged them into departments they were interested in. So it worked out really well. You do not need to volunteer in something COVID response related to also get involved in research. They can be separate from each other totally. How can we access links to these opportunities? I don't have links to them yet, but that's what I'm hoping to come out of today is some of our leadership, once they have roles pinned down beyond the general, like I know I can take 2 volunteers in admin, right? But if I could hear from the nurse manager that she has 2 roles in urgent care, then I would have something more concrete to share for you. Do you mind clarifying the form Aminta sent? Yes, that was the interest form from last month that 208 of you replied to. Oh, and thanks. Aminta's going to send another one today. If you were to live in Berkeley in the summer, could you volunteer for several hours in one day? Again, it just depends on the role. I have one student who comes and goes from Canada, and so she's here for a few months of the year, and when she's here, she does 3 days a week as a pharmacy runner. That's her self-chosen schedule, and she's brilliant and dedicated, and we're happy to have her. So it's all very personalized to you and your goals. And I really wanted to just take a quick moment to say that, school and health and social and emotional health, all of that comes first. This is not an opportunity that's like do or die right now. Like if you don't sign up for a 4-hour shift right now and dedicate to 2 months, you won't ever do it again. You're in one of the most competitive universities in the world, and you've got to take care of yourselves and take care of each other, right? So don't feel this crazy pressure. This is a fluid program. It's a warm program. It's going to be ongoing, and we'll find a place for everybody. So I really hope you can feel comfort in that. How do we indicate they're ready to volunteer? Let's do, so Aminta's sending some follow-up information after this, and maybe we can do just a real targeted question, and I'm happy to make it, or she could too, like a form, because if there are a few of you that are really specifically only interested in vaccines or only contact tracing or ready to go right now, we're going to start ramping up for getting you oriented to those specific roles and getting you on board. Of course. So we're happy to do it. Indicate that we're ready. Okay, I think I got most of the questions in the chat. I'm gonna go back, or if you could reshare the questions document, I want to make sure I didn't miss anything there. Oh, we've got some over here. Cool. Thank you, thank you, thank you. And feel free to talk too if anyone wants to say anything. You're a pharmacy tech. Is it possible to connect with me on how to get involved with surgery? With UHS. Yeah, if you're a pharmacy tech and you're interested in volunteering at our pharmacy, we'd love to have you. Don't have to be a pharmacy tech. That's a good point too, guys. If you've never done research before, if you've never ever done research before, if you've never volunteered, if you've never been in an admin role at all, still do it, right? Still try. Now's the time. So if you don't know what a lit review, if you've never done it, ask. Like, this is the best way for you to learn. We're going to be the easiest partners you've ever had. I'm biased, but UHS staff are the nicest medical workers you'll ever meet. And so don't let experience that you don't have hold you back, because now's the time to get it. You guys are so fabulous. They're all so nice, aren't they? I love them too. Various opportunities, orientations, and signups will come together in the following weeks. Yes. I can tell you right now, here, this is off the cusp, but let me share this to you. So lots of you responded to Aminta. I'm going to drop my personal volunteer interest form in the chat. This is really specifically targeted to the vaccine clinic, to meal delivery, and contact tracing. But the people who read this doc are all responsible for those. Oh, and this also feeds into surveillance test sites. So you can complete this form. Someone other than me may contact you, and if they do, that's fine. I'm still doing your credentialing and your clearances, but if another manager from UHS contacts you, that's fine too. But just so I'm not feeling like you're walking away with nothing today, I really want to be able to capture your names. I'm going to put this to all of you. But I defer to Aminta on follow-ups too. But that's my form. It feeds to about 4 or 5 managers. And this is also part of reserve. So if they suddenly need 20 people to deliver meals, they're going to pull on that too. Okay, if you want the vaccine, we'll be directed on how to get it. Proof of our eligibility. I can tell you that we have a lot of graduate student instructors, my own volunteers at the site. They were able to go to My Turn. They listed themselves as being in the education field, and they were not asked to prove anything. Health workers tend to be asked to prove at My Turn, but education have not. We have a lot of high-risk medical students that went through the Coliseum site via My Turn, and no one has been asked. I'm happy to draft a letter that says that you're an essential volunteer at a medical site in an institution of education. I can easily draft something general and share that to Aminta if someone would like that. I will tell you one thing I don't want to do is to say, oh, just email me for that, because I get hundreds of emails a day and I may not respond quickly, not because you're not important, just because you're literally buried in emails. So if you want sort of a general letter and you're on board and volunteering, I want to make that more accessible than asking me personally. Scrolling up in this doc to read. Vaccine clinics, volunteering limits we got that one. If currently not in Berkeley. Remote opportunities, yes. So I know there are a few, I think I talked about this a little bit earlier. There are a few contact tracing opportunities that might be remote. What program do I recommend choosing? I recommend you deep in your heart, evaluating your strengths, evaluating what you're afraid of, and choosing a role that involves both of those. So if you're nervous about public speaking, InfoDesk is a great way to challenge yourself, get outside the box, and do a little bit of public speaking in a protected environment. That's at the COVID vaccine site. Um, if you're interested in being a doctor, but you haven't had direct patient care, being a swab coach would be the best role for you because the patient is just, when they're in front of you, they really trust you as the one to take care of them. And that sort of boosts you into this role of a very simple process that you're walking them through, right? You're not swabbing their nose, they're self-swabbing, but you're talking to them, you're nurturing them through it, and it is considered a clinical role for any of your future goals. So I recommend everything. I myself have worked at the test site and I've been at the vaccine site and I love it. So I couldn't choose for you.
Yeah, Ashley, if I can jump in on this a little bit, because I'm a volunteer vaccinator, and it's been so wonderful because all of our clinical stuff as medical students has been kind of shut down. So this has been a great way for me to get hands-on patient experience, and I'm actually doing the injections. But there's so many volunteers there who are doing the basic life kind of observation that are really enjoying it, and people who direct the line. There's so much that you all can learn from every single opportunity, and I think one of the things that we are here to help with in terms of white coats is help you write about it after. So everything you do is valuable, and this is such a huge part of community care and of making sure that we're all caring for each other in this time, that it will be excellent for your future applications and anything. So you don't need to worry about picking the one that is better for the applications or whatnot. I think Ashley had the best advice here about picking what you're a little bit afraid of in terms of like personal growth, not in terms of vaccine safety and that sort of thing, COVID safety, but just making sure that you're, this is the, like one of the most supportive places that I think you'll find as a pre-med student. This is not the traditional Berkeley culture, pre-med culture thing. This is a space for you to learn and grow and for you to be supported by staff who really want to see you do your best. So I actually made a form that I'm going to drop in the chat right now that is tangent to the form that Ashley shared, but it has all of the information that we need in terms of white coats to make sure that we can get you onboarded and oriented, and also determining which role you're most interested in. At this time, we're just going to ask you to put one just so that we can prioritize. But if there's a question at the end where you can add on more information. Also, a couple people have asked me in the chat about the training on March 22nd. Just a note, that is over spring break, so you will have to be here around spring break. But you can also RSVP for that in this form that I just put in the chat. Thanks
Oh
for
my
letting
gosh,
me.
fabulous. Yeah, I say defer to Aminta's form. That's going to be a lot more targeted than mine. You're welcome to mine too, but I'll be pulling through hers too. The training on the 22nd is a great opportunity. You'll get to meet some staff here at UHS. I literally found out about it this morning. I thought, oh my gosh, I have to tell Amita. So would love to see some of you on site for that. I referred back to my other document with some questions that I pulled from your response form, and I wanted to address PPE and infection control. So I can say, as healthcare workers, we take care of each other. We consider ourselves leaders in infection control and models for how it should be done. And so when we went into shelter in place and all of campus went home, we did not. So there are about 300 of us, and we evaluated who can safely work from home and who has to be here to provide patient care. And if they're here, how can we keep them safe? And so we really were the model. We are the model for the rest of campus. And when you all come back, we'll have been the test run. So that said, we follow all protocols. We wear surgical masks. We can sometimes wear a cloth mask over that. I'm only not wearing my mask because my office door is closed. We wear a mask within 30 feet of anyone in an open space. So 6 feet physical distance, but if you saw me in the lobby and I knew you were within 30 feet of me, we're definitely double masked. That served us well. I don't know if you see the sort of workplace exposure emails that go out. I do believe they're public, but you can track on departments and if there's been any community spread within a department. And at the Tank Center, we're really proud that we've taken care of each other that way. The vaccine clinic is rolling into 6 weeks, and we have had zero community spread of COVID in any of the vaccine staff. So a lot of that comes from responsible reporting of, gosh, I saw my friends outside on Saturday and we physically distanced, but one of them has a cold, so I'm going to stay home. And there's no stigma. There's no stigma to say that. So that is how we run infection control and keep each other safe. Swab coaches, you would wear surgical masks with face shields. There is a report from occupational health that comes out daily to tell us if we should upgrade to KN95s or respirators. Yeah, so there's lots of communication around it. I was just trying to tell you all the reassuring things that I know. But I've been living and breathing this for over a year, right? And I'm really proud of how we take care of each other in that way. Do we fill out both forms? Isn't that confusing? Oh my gosh. Amita, what do you think? Fill out both forms? I'm
I
gonna
mean,
get everyone's name, but
yeah. I mean, our form, you will have to fill out our form just so that we can keep track of it for our funding. I think Ashley, the other form that you have might have other information for the different groups. So just do both if you have a chance. Just do it while
why
you're in
not?
this orientation. We understand there's a lot of forms and things, but we just want to make sure that we're tracking everything and can keep track of you all. Because there's a lot of you and only two of us. So thank you for being with us.
Yeah. Thank you, Srithika, for answering the question about basic life support. So Zora, the BLS certificate is a great thing to have if you're on track to anything in the medical field or even a responsible community citizen. Um, it's highly valuable in places like a vaccine clinic observation area because after the patient is injected, we're watching for anaphylaxis or fainting or a reaction they might not even know that they're having. So we have EMTs on board and anyone available to help with that. There is March 22nd is not an orientation. That's a BLS, a basic life support and CPR course that UHS staff is doing here. And since we were having it on site, we said, well, we've got the space and the teachers coming in, maybe we can open it up to students. So you did not miss an email. That was like a last minute. We found out today. Amita pulled together an amazing slide, and she's going to follow up with some more information. Can you continue volunteering after 2 months? Thank you for asking that. I forgot to address that, and I saw that earlier. It depends on the role. So right now, you're all in Berkeley. You have affiliate IDs or student IDs. We have umbrella insurance coverage. And so that's how people like Aminta are giving in injections and she doesn't have to carry on medical liability insurance. That's how I could fall down right now and I'd be covered by occupational health, right? But if you graduate, we can't guarantee that for you. So you roll into a population called community volunteers. The only thing that's tricky there is it's difficult for us to give free COVID testing to a community volunteer. So I'm not going to say no. I would say it would be a little bit difficult and a little trickier with the role. That said, at that point, it's a really good time to turn to someone like a fire department or something like the Coliseum site. We have a network of people there where we could connect you and say, this is a Berkeley grad. They were with us just for a short time, but they're amazing. Can they volunteer with your site? So I wouldn't say graduating is the end all be all at all, especially because we can help you with it.
Yeah, and Ashley, if I can interject just a couple tips for people who are going to be volunteering, I think it's really important for any pre-med student to keep track of how many hours you're doing and what you're doing as you're going through it, so that at the end of this volunteer experience, you could say, hey, Aminta, I volunteered for 300 hours. I don't know how many, whatever. 300 hours with this. Would you be interested in writing me a short letter of recommendation about what I did here? Making sure that you're building kind of your experience as you're going. I definitely think that's something that White Coats could support. I also think it's important for people to think about the contact tracing portion of it in terms of public health. I meant to say this earlier, but that's a huge thing that is going to be a super vital and job good for jobs, whatever the word is, are later. And especially if you're interested in doing gap years to get more experience, being a contact tracer now will be invaluable for public health departments. I worked at the San Francisco Department of Public Health for many years, and that was something we definitely looked for in terms of hiring people. So not only are you going to be able to provide this amazing service for our community, you're building this huge resume for yourself, and especially if you do a couple different things as like for however long you stay. And I wanted to comment on the last thing that Ashley just said about connecting to our larger communities. People are really scared right now, and there's so much fear and so much. It's been so hard for people this year, and I know that you all have been struggling with school and everything. And so this was just a way for us to be able to reach out to you all and make sure that we can support the larger community, both of UC Berkeley, and then hopefully train you all that even after you graduate, you can go out and become the healthcare workforce that California really needs and deserves. So I really just wanted to thank you all because I know we're running up on our last 5 minutes. So I wanted to thank you all for joining us today. Ashley, were there any other last questions that you wanted to cover before we close out?
Yeah, I'll quickly say AM, PM shift times are structured for vaccine and swab shifts, and they're usually 8 to 12 or 8:30 to 11:45, and then 1 to 5 or 12:30 to 4:30. So structured times, those would be good things to count on Monday through Friday. Jason, thank you for mentioning, does contact tracing count as clinical volunteering? So in regards to the vaccine site, I distinguish clinical from non-clinical roles because I'm coming from a risk management insurance purview. But if you were to volunteer in anything with UHS, you would consider yourself a clinical volunteer. So when you're applying and you're writing your letters, you would be considered a clinical volunteer. But then here at the site, I'm putting you in a non-clinical role, just because that's what you would be credentialed for. We volunteer more than one way, definitely. Just be mindful of your time and your healthy balance. That's all I had. So I turn it over to you for closing, and I just thank you all for your time. And I know this is a great leap, a great place to leap from, and I'm really looking forward to it.
Awesome. I just personally, and I know collectively, please drop it in the chat. Everyone say thank you to Ashley. She has been a champion of champions and has made my volunteering onboarding this is the smoothest that it's ever been in any volunteering that I've ever done. And she is working so hard to make sure to manage so much for the Berkeley community. So I really just personally want to say thank you so much, Ashley, and for partnering with us. White Coats is so excited to be doing this and to support all of you students going forward. So I think there's tons of people saying thank you in the chat. Like earlier, please make sure that you fill out that form. Thank you for the student who reminded me that names were not connected to it in the beginning, but we fixed that issue. So we're looking forward to having you all start as soon as possible and as soon as you're ready. And make sure that if you are interested in the March 22nd event, that you select that on the form. And that is all. This will be posted on our website, White Coats for Black Lives, WC4BL.org. So we will make sure that you have access to this recording. Forms, please just do them as soon as possible. I'd say a deadline by end of next week. So yeah, thank you so much, everybody. Have a good day.
Great. Bye, everyone.
Thank you.